Hello from England now, where I'm doing this. This is a patient of mine, and you can see what's happening is that her labiomandibular groove, or the corner of the mouth, goes down on her left side, and she has denting under her lower lip. Now, this is basically from grinding, bite down, and she does produce some grinding over here. You feel her masseter muscles relax. And so what we want to do is extend the lip out so it really lifts up that corner. And the agent we're going to use now is a new agent that's been recently approved in America by Allergan Pharmaceuticals called Juvederm. It's a form of hyaluronic acid again, as is, Restylane, another product we use, but this is slightly different in that the particles are just different sizes, producing essentially a sheet. It has a little better flow characteristics, meaning it's sort of easier to inject, and is softer when felt in the lips, supposedly when used. And so we're going to put this right over here, and what we're going to do is we've used some numbing agent here. And the first thing we're going to do is extend her lip out. Open your mouth. What we do right here is we stretch this open right here. We go into the corner of the mouth, and what we do is we go very slowly. The key thing is to take your time. And what we do is inject the corner of the lip right there. And what we do is bring up the corner of the mouth. Hold on one second. And you see that folding down the corner of the mouth? As we go there, close your mouth. You see how most of that is disappeared, that labiomandibular groove, because what I saw first was that she was missing that end of her lip. Now what we want to do, now bend down a little bit so let me look at this, is you see a little of this readily right down here. See what you're seeing? And so basically what we want to do is to reinforce this, so we're going to float a little of this right under the skin. We float a little of this right under the skin, just like this. Bear with me. And can you see that lifting up? And again, you use the serial puncture technique. And what you do when you're doing this is you're stretching the skin, because you want a firm surface to inject against. And up here, again, you build your flying buttress, much in the same way we use any agent to correct the corner of the mouth, to hold up the corner of the mouth. Let's take a look at that. Hold on. And let me just go right up here and put a little bit, I'm going to pull down here, right at the corner of the mouth. And so basically what I'm doing is pulling everything anterior, because you want to bring all the redundant skin here, anterior. And how much did that hurt?
It didn't.
Okay, so the topical agent was used is, the beta-cane that's made by the Tampa Pharmaceuticals in the U.S. It's available as beta-cane LA in Canada. We use that as a anesthetic agent here. Now what you want to do is go very, very slowly, and you don't want to see any of the agents on top of the skin. You don't want to produce any marks of bruising. Now what you notice is she has this dent in her chin right here. Do you see this? Just rest your head. And so we're going to wipe that off. We're going to get rid of that dent. That's produced basically by our dental grinding. Remember, the main thing that supports the lower third of the face are your teeth. Now a lot of people will massage heavily after they inject, and I'm not one of them. And the reason that I really don't like to massage heavily after I inject is because I think it forces the agent deep underneath the skin. Now the HV agent, which we're using, the 24HV, has free hyaluronic acid within the product, and it does so, it increases the flow of the product. So basically you're going to see this line go away. Bear with me. And you also insert the needle as gently as you remove the needle. Bear with me. And we're going to put this, we enter again at an angle, and we flow the material nicely along that angle. You let it flow and fill up all that area we're looking at. Hold on. And we see right now that we still have a little bit of a dent right in the middle of that area. We'll go right up here. You see this go right up. So basically, take a look at this. Okay, so we'll put a little bit more here. side. We'll put a little more right here. A little bit more right here. The key thing with the hyaluronic acids is they can produce a bit of bruising. And what you want to do is go very slow with them. You also want to make sure that your patients don't take aspirin or Advil for a long period of time. Now, there are various agents available. You have to always make sure of the purity of the agent that you use. And while there's been a whole host of new products, including people talking again of permanent agents, remember, they don't age with the face as which ages over time. So you don't want to stick anything in the face that you can't retrieve. So what we can see is the corner of her mouth goes up now on the left side, but it's not going up that much on the right side. So we want to extend the outer portion of the lip, because the outer portion of the lip is a little bit inside her mouth. Do you want to open up gently? And so what we want to do is we want to stretch this lip. We're going to put a little bit in the corner of her mouth. You'll see it gently flow. See, the key thing is to gently flow in the lip. As you can see, you always see it gently flow. And then what you want to do, hold on, is gently move it. And what you want to do is open up just a little bit, is gently go up this corner. And you stay in the potential space, basically on the inside of the mouth. And doing the shot again that I showed you before, this very video with another agent. You want to lift up the corner of your mouth. Okay. But you always want to lift up, inject up. And always make sure that you're comfortable when you inject. You can see that little line that I want to inject right there. You all see it? And here we go. We're going to stick the needle right inside the lip in that potential space. By injecting that, hold on. See how this lifts up the corner of the mouth. You're doing it from the inside of the mouth. Just let me remove the needle. Close your mouth. Now, see how the corner of the mouth is up? Or you want that up a little more. You still see a little depression outside here. So we're going to go in the potential space under the lip. But we're going to bring that in, because what you want to do is pull everything in over here. So basically, we pull it in under the mouth, just like that. In doing so, we lift the corner of the mouth. Because one of the things that occurs as we lose the end of our lips is the corner of the mouth goes down. Now, basically, what we're going to do, did that hurt? Okay, basically, what we want to do, you were numb on this side also?
I don't think so.
No.
Not at all.
Now, how much did that hurt?
No, it didn't.
So basically, the other thing is to keep going slow. Again, pull the skin tight. And basically, what we want to do right over here is go into the lower part of our chin right here and get rid of that dense from this side. And some people stay on one side and inject across the face. And by doing that, you're always going to produce distortion, because you want to pull everything in from the outside. Meaning there's a vector that pulls everything in rather than pull everything out. Because tight faces are the result of facelifts. And a tightness is nothing about being youthful. Youthful is about returning the volume to the face. And the area that cannot be restored by plastic surgeons, there's a little dent still right here, is the lower third. And by restoring the lower third and pulling everything into the center of the face, you really increase the facial volume. Right there, we just did that. And we just do that right here. Is that? Hold on. And we restore this by doing a little bit of this, the lower third of the face and the jawline. So putting it right here, because this goes into the jaw, and then we're going to go up a little bit up. So basically what we're doing is restoring her jawline. Come over this way. Again, firm pressure and do it slowly. If you do it in 5 minutes, it's not going to work. You have to take your time. Especially with the hyaluronic acid agents, which are more difficult to flow than the collagen agents, because you want flowing under the skin. Okay, just look right over here. Okay, let's just take a look. you take a look how her mouth goes up. Just open your mouth just a little bit again. And there's a little bit missing. Now, where is it missing? You see where it's missing. She had a little crack in the corner of the mouth. We're going to lift up this corner one more time again because we want to get this corner up just like the other side. And then we go right inside the lip. And then the last thing we do is kind of a 32 gauge needle is I want to deal a little bit just with that little crack, and you can see that little crack in the corner of the mouth. And as you see that little crack, it's mostly from dental work right there. Are you feeling bumpiness inside your mouth? Mm-hmm. Nothing whatsoever?
No.
Okay, and it didn't hurt whatsoever?
It really didn't.
That's good. So what we want
Especially on this side, and it wasn't numb.
Okay. What we want to do is a little crack in the corner of her mouth. You see, open your mouth. See, that thing is something there, lipstick would get caught, and you want to get rid of that. And what we're going to do is go very much into that unit, and we're going to go up there with a much smaller 32 gauge needle. Right there, you see, that's superficial. That fills the side. Now close your mouth. What you see, anything left? So we had some flooring with the 32 gauge needle. And you had no pain whatsoever. No. So this has some better flow characteristics than some of the agents we've used. And basically what it does is very easily, fill the space, but you again have to go slowly because you don't want to bruise your patient. As you can see, her chin is coming up. And basically what's going to happen is she's going to swell for a day or two, but she really doesn't usually bruise in this. You can see that all the chin space is getting full. Now when I do this, when I make lips full, and when I do the lower third of the face, it's not detectable because people really don't know what they're seeing if the lips look normal. If you make lips look abnormal, they're readily apparent and they're not attractive. Remember again, the focus of the face is the eyes and the lips, and the lips you also focus with the lower third, the support system, which for the most part is not amenable to cosmetic surgery. It's amenable to injectable fillers. I took down again. You see all this now is restored, and our lip goes up on both sides. You were great today.
Thanks.
Right. Now the key thing is you want to just see her upper lips, upper teeth. You don't want to see all of her lower teeth. And you don't want a gummy smile. That's what's really important. So the kinetics of the smile is equally as important. And you see both her corners going up. And you see full volume return in the lower third of the face, because that's where people lose volume that surgery doesn't correct. Because there's a time to pull and a time to fill. And the time to fill is becoming the biggest portion of it.